You're listening to Cottontail's podcast, part of the Silicon Valley Black Project, which produced the documentary film A Place at the Table about the Black pioneers of Silicon Valley. A Place at the Table can be viewed for rent on Vimeo.com on demand /A Place at the Table STEM. Through Cottontail's podcast, the Silicon Valley Black Project will continue to recognize the contributions made by African Americans. We will be featuring African American professionals, technologists in the fields of engineering, administration, and entrepreneurial pursuits from the past and present. Today, we are speaking with Patricia Nero, the former director of pharmacy for San Mateo County. She is one of the unsung heroes making miracles happen with an understaffed pharmacy department, responsible for covering the clinics, the county hospital, and the county jail in San Mateo County. Mrs. Nero speaks about her education at Howard University, her move to California, and the challenge she faced as director of the pharmacy. We are talking about you today.
Well, I don't know how interesting I am. I've led a pretty boring life.
Most of us think we haven't done a whole lot until you start talking. It's like, I did do that, didn't I? So tell me first tell me where you were born, your family, your siblings, and education and that good stuff.
Okay, so I was born in Washington, D.C.
Mm-hmm.
Out of my family, I was the only one that was born in D.C. My parents came from Louisiana, and my dad actually had a job with the post office because he had passed the post office exam. I think he was the only Black that had passed this post office exam. He was working at a delivery person at the Chinese store. My mom was pregnant with my oldest brother. So they came by and wanted to know if he was going to take a job, the white man.
Yeah.
Because he was this Black. He said he didn't even know he had passed it. They didn't want to tell him. So anyway, he was waiting on him to come home so that he could get his paycheck so that he could take the train or the Greyhound to get to this place. He missed it, and because he had to wait, when he got to Virginia, he didn't get the job.
Oh. Because
they had already filled it. Mm. Of course, he didn't have the money to get back home, back to Louisiana. So he called this friend. There were three of them that lived together, and he said, well, come on. And that's how we got to Washington, D.C. And then he got a job. He worked at the Capitol in the kitchen, in their cafeteria. And so then my mom came, and then my two brothers and my sister came later after they got established. But I was the only one that was born here. So that's how I got to D.C. My dad worked two jobs. He worked for the printing office, and he worked in the Capitol to save money to buy what became our family home. I went to D.C. public schools. I went to Howard University, and I graduated from the College of Pharmacy in 1969. From there, it was a decision of what you were going to do. Was I going to work for People's Drug Store, which I didn't want to do because I had worked there during my summers, and I realized that retail pharmacy did not have my name on it. Mm-hmm. There was no way that I was going to work in a drugstore. So I went to this party. The guy that I had been dating said that his old counselor in St. Louis was now at the University of Colorado, and they were looking for Blacks to come into their program. And don't worry about anything, just apply, and he would make sure that we would get in and then we would get a grant. So I did that, and it also did, there was a posting in the School of Pharmacy for an internship at the VA. So I applied for them both. Of course, I didn't hear from either one of them, so I thought, okay, So I said, whichever one comes first is the one I'm going to take. They both came the same day.
Of course.
Of course. So then there was a decision to make. Do I go to school and get a master's, or do I go and take this internship at the VA in Palo Alto in a hospital? So I thought long and hard about it, and pharmacy was 5 years. 2 of those 5 years I went straight through. So I had been going to school for 17 years. And I thought, do I really want to go to school for another 2.5? So I ended up taking the job at the VA in Palo Alto. So that's how I got to California. At the end of my year internship, they would place you in another VA because they had trained you. So the only one open was back in Maryland. And I thought, I don't want to go back to DC or Maryland. I didn't have a job for a couple of weeks. So my money ran out. I had applied for a pharmacist position with the county of San Mateo. Mm-hmm. And I was number 1 on the list. But I didn't get the job. So they hired someone else. Uh-huh. So then I definitely had to go back to DC. So I went back to DC and I was working at People's because I wasn't licensed in DC. I was licensed in California. And California didn't do reciprocity, which meant I had to take the pharmacy boards back there. So while I was working on doing that, I got a call saying that the person who they had hired didn't work out and that if I wanted, the job was mine.
Get it.
I packed up my little stuff and then I moved back to California. I was a staff pharmacist at the county starting in October of 1970. And I worked as a staff pharmacist for 7.5 years. The director retired, left. And so I applied to be the director of pharmacy. And I got it. So I was director of pharmacy for San Mateo County. And as you know, in San Mateo County was hospitals and clinics. We had clinics in the hospital, outpatient clinics, and then we ended up with satellite clinics. And we had in the county 6 satellite clinics, 6 or 7 satellite clinics. And so I oversaw all those clinics besides the hospital, as well as the jail.
As well as the jail.
The jail, because the jail had drugs. And so anything that has drugs and is in the county system came under my purview. So we had that. We had a methadone clinic at the VA in Menlo Park. We had clinics in Fair Oaks, East Palo Alto, Daly City, Half Moon Bay.
How many employees reported to you?
At that time, I had 6 pharmacists, 5 techs. No supervisor under me because the county didn't want to pay for it. It was interesting. It sounds like a huge area to cover, and it sounds like, but the buck stopped with you. You had no one in between you and those pharmacists. No.
Is it still like that, Pat?
Oh, of course not. Once I retired, they got a whole bunch of stuff. They ended up with 12 pharmacists, and there were 2 supervisors, pharmacists, 9 or 10 techs.
So how did you contrive a way to get all of that done, having no structure under you to assist you with that?
I had a couple of pharmacists who would take on some responsibilities. They didn't get paid for it, but they were very good. And they would take on some responsibilities. But, you just learn how to cope and do it. I mean, we were filling, at one point, we would fill something like 200 and 300 outpatient prescriptions a day. Besides doing the inpatient work, we would do that many prescriptions a day. And you just did it. You didn't think about it. It was work and you did it. And at that time in the, I want to say in the mid 70s, 80s, there was a shortage of pharmacists. If we lost someone, it was really difficult because we had a hard time filling positions. Most people went to the drugstores because the Walgreens and Longs and all those could pay more. And so they were looking at the money. Walgreens at one point said that they had enough pharmacist position that they could hire every pharmacy graduate and still need more.
Wow.
The other thing is most people, if you went into retail and you wanted to transition into hospital, it was different. Because in hospital pharmacy, you have to read patient charts, prepare their medications, look for drug interactions, prepare their IVs, prepare their chemo. So it was different. It wasn't a matter of getting a prescription, you need 30, counting them out, putting them in a bottle, labeling them, and, telling them, you take this and that. It was totally different. You had to review it, make sure that what you were giving them didn't conflict. It was difficult finding people who could transition from outpatient or drugstore to hospital.
Yeah.
So when I started at the San Mateo County, they weren't doing IVs, so I implemented that. They weren't doing individual doses, so I implemented that. I implemented the chemotherapy for our cancer patients. I ended up, this happened just before I left, getting a huge counting machine so that we could speed up the outpatient prescriptions. That was implemented after I left. I started that. And so that was my career. I was on the Affirmative Action Committee for the County of San Mateo for a couple of years when they had sexual harassment and everybody had to be taught. So we would go, I was on that committee where we screened who was going to provide the information, picking out the company that would implement and do this for what we were doing, and looking at how we could increase the numbers of employees to reflect the population of San Mateo County. So if you had, say, 12% blacks in the county, you wanted the county workforce to represent 12% of the blacks, or Chinese or whatever. That's basically what we did. So after my retirement, it took me a year to distress because when you're working, you wake up and you think of all these things that you have to do. You're overseeing these clinics, you're overseeing, making sure that you're following all the rules and regulations of the Board of Pharmacy and the state for Joint Commission. So it takes you a year to distress. So I did that, and then I ended up working for a consulting group. I went to Victorville, to the hospital, to take over and be their pharmacist in charge, their director, until they could find a permanent employee. I did that for a couple of months, and then I had a vacation. So I left and did that. And then I came back, and then they wanted me to go back again. So I went back again until Victorville decided that they weren't paying anymore, so that ended that. Then I ended up going to Ukiah and becoming acting director of pharmacy until they could hire someone. And then I went to Massachusetts to help the hospital there in Pittsfield set up their SureMed system, which is an automated dispensing machine for inpatients. And so I did that. Another consulting job was at Peninsula Hospital while they were transitioning to their automated medical record system and pharmacy system. I worked there to help them transition. So anyway, and so that was my last consulting job. After that, I spent the rest of my time traveling. When I was at San Mateo County at that time, and that was in 70, 71, there were only 2 professionals in that hospital. When I say professionals, like there was one nurse, and me.
In the hospital, the county hospital?
Mm-hmm. Now, you had other black employees.
Okay.
Level. You had one RN and me. You had some LVNs, but as far as an RN, and there was one. Later on, they had the director of dietary was a black man. They ended up with, and there was Edith. You met Edith. She was an OR nurse, and she became director of nursing for the outpatient clinics. Mm. As I look back, 2 black physicians, one was an OBGYN and one was a cardiologist that I had met. He was at the VA at the same time I was at the VA. Ah. And he came and he was there, and then he left and went into private practice.
Okay.
So there was not a lot. So
yeah, but now back to the beginning when you first started off as a pharmacist for the county. What were some of the barriers that you had to overcome, and those that you overcame? How did you go about doing it?
San Mateo County was very interesting. San Mateo County was probably at that time the second richest county. Mm. You know, you have to realize you had Hillsborough, you had Atherton. It was a very rich county. But as far as the hospital was concerned, I don't know if they didn't want to be I don't think they wanted to be in the hospital business, but they absolutely had to. And so the budgets were always squeezed. Depending on what you wanted and what you could get, was that they were trying to hold the bottom line. And it was difficult in getting new stuff, except for they wanted you to make money. In hospitals, your revenue generating departments are pharmacy, radiology, and lab. Those are the departments that generated the most money. Mm. You have to realize that you paid your nursing in your hospital, but as far as really being your revenue generating departments, it's pharmacy, lab, and x-ray.
Right.
Those are the ones you want to do it. So when they wanted to establish little systems, you could get that, but when you wanted to expand or do something, it was always a crunch. There was a hiring freeze, or you couldn't find people. So you had to kind of do those things to work around to do it. Because every year, every 2 years, it was this constant turmoil of closing the hospital, especially county hospitals, because you couldn't refuse a patient. Mm. I mean, we actually had patients dumped on us, whereas they would come into San Francisco, they would be sick. Well, the closest hospital is Peninsula. They take them there, or you don't have insurance, take them to the county. And so they finally had a law saying you couldn't dump patients. Yeah. But if they didn't have insurance or anything, they got dumped onto the county. It was a never-ending cycle. And then they ended up, because the county hospitals were not seismic ready, the state had all this money for the county hospitals to build new facilities that would meet the seismic requirements. So that's how we ended up getting a new hospital and clinics. So that was a part of it too, planning the new pharmacy space according to pharmacy guidelines and getting enough space to do what we needed to do.
So you were part of that process.
I was part of that too. It was interesting. And even though every year we request money because we wanted to extend our hours and our services, you can't do that unless you have the personnel.
So can you say there were times when you say you had, when you wanted to get something done, or you needed some type of instrument or program to be installed, that you had issues with management, or who was your management? Who was managing you?
Hospitals are never the highest paid or the lowest paid. They're always somewhere in the middle.
I see. Okay.
They're always in the middle.
So the added...
And I know that there were staff pharmacists on the peninsula that made more money than me, and I was a director.
Staff pharmacists? How could that possibly be?
Because they were in private hospitals.
Oh, I see.
The private hospitals.
But then
So
the payoff would be the pension at the end of all this? Yeah.
right. So they don't pay you well while you're working there, but they pay you handsomely when you leave.
When you leave.
When you leave. That's the trade-off. The benefits, if you can take it or exist, then you're rewarded at the end.
Well, what made you go into pharmacy? Had you always wanted to be a pharmacist?
I think I wanted to be a pharmacist. I decided I wanted to be a pharmacist when I was probably in the 10th grade. I had a knack for sciences and a knack for math, which I don't have now. But anyway, at that point, I was very good in science and I was very good in math. Mm-hmm. And so when you look at what do you want to do, I didn't want to be a teacher. I didn't want to work in the government in D.C., which probably would have been lucrative, but I didn't want to do it. So that's how I ended up being a pharmacist, which is a profession if you can stick to it. At that time, you applied to pharmacy school, and you did 2 years of pre-pharmacy, and then you did 3 years of pharmacy. So at that time, like I said, you applied to pharmacy school in California and Michigan. In their pharmacy schools, you got a PharmD. And you went 6 years. But those were the only 2 states at that time when I was going to school in the late 60s. Those were only 2. So I have a Bachelor of Science in Pharmacy. So one of the things what I was dickering with was to go to Colorado and get a master's in pharmacy as well as an MBA because they had a dual program. And as I said, I was burnt out. There are very few schools that have that program now. I was surprised when I got to California that everyone had a second degree. They had a BS in something else, and then they went to pharmacy school. So I thought, why would you do that? 4 years and then turn around and go some more, But that was me. So now most programs you get a PharmD, a doctor of pharmacy, and you go like 6 or 7 years, and so that's the evolving of curriculums and schools and money.
Yeah.
Think about it.
Yeah.
Think about it. If you have to pay, $20,000-$30,000 a year?
At least.
Howard was $200.
Oh my gosh. And you're talking 6 years of school?
Yeah, Howard was 5 years of school, and it was $200 a semester. Mm-hmm. But then, that if you translate that now in today's money, it's probably $30,000, $35,000, $40,000 a year.
A year.
So I can understand why people want, free education.
Yeah.
We didn't come out in debt. We didn't have this huge debt of having to pay back. What was a student loan? I didn't even know what a student loan was until I had my daughters and they were applying to school and I go, I got to get a loan?
This push we had after the 70s for everyone to be degreed in order to be accepted or even considered for certain professional positions. And that came after affirmative action when they start laying these laws down, thinking that was going to be the gatekeeper to keep the black folks out when you start demanding these higher levels of education. And they looked at the numbers that existed and they didn't see that many of us in there. They figured, okay, if we just say you have to have the minimum of BS degree in order to be a quote-unquote engineer, that's going to keep them out. So what did we do? We went to school.
Exactly. So in DC public schools, back in the 50s and the 60s, the high schools had what they call a track system. That may sound bad, but it really wasn't. So track 1 and 2 means you were college prep, that you intended on going to college. So you took those courses to go to college. 3 was that you weren't going to go to college, but you were going to have a trade. Mm-hmm. So those were the people, especially in D.C., who took business courses because who's the biggest employer in Washington, D.C.? the federal government.
Right.
So therefore, you learned how to take shorthand. You learned how to type. Those business subjects, or you took printing, mechanical drawing. You took those trade, carpentry. You took those trade things so that you could get a job in a trade.
Mm-hmm.
And then track 4 was if you were special needs. So once you were placed in that, because you knew that, then your skills were tailored to what you would be able to get a job at once you graduate.
Right.
Now, what happened after I left DC, I don't know, but that's the way it was, and it really kind of worked out. If you knew you were going to go to school, then you went to Howard or DC Teachers, wherever you wanted to go, wherever out of state or whatever. But you knew you were going to go to school, and you knew that you couldn't go to school, and you didn't want to go to school. Your parents couldn't even afford that. Then you would go to work in the federal government. And I had several of my classmates who went in as secretaries and really, really advanced,
mm-hmm.
because the federal government at that time would give you courses to help you go to the next grade level.
Mm.
I don't know where we.
I just wonder too. I guess with the changing of the political environment in Washington D.C. has affected all those programs as well. Because people have gone back to the thinking that was going on in this country prior to 1960, and that is that those folks over there with all that melanin in their skin are not entitled to these jobs. These are jobs for the superior people of this country, and they just happen to be white folk in this case.
And you're not smart enough to do it.
Right.
They don't, even though you're probably 10 times when you're the smartest person in the room, they don't want to recognize the fact that you're the smartest person in the room because of your melanin.
Exactly.
And you're way, way smarter than they are. Or they want to tell you how to run your department.
Mm-hmm.
Well, we want to do this. Well, you can't do it. What do you mean? I go, well, when you go to pharmacy school and you pass the board, then you can do it. I said, but as long as my name is going to be on it, we're not doing it that way.
Right. I'm the boss.
Yeah. You're not going to be the one that they're going to come after. It'll be me because it's my name. I'm the one that says pharmacist in charge.
Right.
Director of. So when the board of pharmacy comes in and the state comes in, it's me. It's not you. But yet you want to implement something that's not going to work. And I'm not going to let you do it under my name.
Uh-huh.
Now, when I leave and you want to do it, cool. But not as long as I'm the one that...
Did you have many of those type of situations where someone got the bright idea?
I didn't have many of those types of situations. Most hospitals are driven by doctors and nurses. Doctors not so much because they just want what they want. They don't care how you get it. But nursing always has this thing, and we want to do it this way because we want to placate someone. And they tend to flip these programs and ideas, but they don't intend to form the ancillary departments, which is pharmacy, lab, x-ray, physical therapy, of what they want to do until they have it already done and they call you in and we go, no, you can't do that. At that time, it was hard to get nursing to understand that you can't do things in a vacuum. You may have these grand ideas, but you should need to pass your grand ideas on to the other people who it affects. Mm-hmm. You just can't run roughshod over everyone. They would want to set programs. We'll do this and we'll have this and this and this and this and then. But okay, that's your dream. But if that's your dream, bring in the other people who have to do your dream. Don't go and get it all set up in a row and then say, okay, we're going to do it this way. What do you think? And then when you tell them it's not going to work, they want to look. Oh, we learned this.
Yes. That Miss Nero, she's so uncooperative.
I'm not going to tell you what they call me.
I can.
You can't
it wasn't Mrs. Nero either.
It was BB.
I see.
You know what that is?
Yes, indeed. Yes, indeed.
So.
In fact, it would seem like in a medical situation, that you want everyone to be on board and be up to speed with the condition that they're dealing with, so that you don't make some catastrophic mistake, i.e. death.
Exactly.
Someone gets the wrong medicine with some, or some medicine they're taking already doesn't go well with the one that's been suggested. You got a problem on your hands.
Right.
Right.
And then when I said, well, you're being so uncooperative, I said, I'm not being uncooperative. I'm just telling you how it is.
Right.
And to let you know that you can't do things in a vacuum. I said, it's not just the pharmacy, it's Dale and radiology and George and lab. Did you ever think that since we all have a piece of this, to bring us in your planning? Don't plan it and then tell us what you want to do. And I think that was...
I guess if you're in medicine of any kind, in fact, if you just take the COVID thing that we're in now, we don't know what this thing is capable of yet.
Right.
So how do we frame this for not only the pharmacists, but the hospitals and the EMTs that have to be involved? How do we get them safely through this so that we are, and at the same time, have our researchers find out what this thing is? I think that was the dilemma that we were facing at the beginning of this, and that is why we all feel our nation has been let down, because nobody thought of the entire process that was going to eventually affect these bodies of ours. And here's 200,000 people laying up because there was no plan of any kind. And nobody wanted to...
There was a plan. We just ignored the plan because the black person had the plan.
This is true. Yeah.
The black person in office who dealt with a pandemic or
Yeah.
had a plan saying, this is what you need to do. These are the agencies you need to involve. This is what you have to do.
Mm-hmm.
Ignored it. Mitch McConnell says he didn't see it, but then had to admit, yes, it was there. Trump, because it was written by the Obama administration, just ignored it. And if they had even just read the first page to tell you who to involve, then we probably wouldn't have had that. And when you have something that's an unknown like that you don't know what it is, you have to depend upon the people who actually know.
Mm-hmm.
What happened was we literally ignored science.
Yes.
We virtually neutered the CDC.
Mm-hmm.
And when we were told that it's this and it's contagious, that you need to mask and gown and do all that, we were told it was going to disappear when the sun came out or it got hot. Ignoring, even though you knew, you ignored the basic protocols. And so when you had these people, until they could figure out what it was and what was going to work, it was just simple guidelines, like if you sneeze, wash your hands, cover your, those simple things were ignored. I think it's, for me as a medical professional, it was horrible that we did not go with testing. Why are we hiding kids? Because we really wanted to seem like it was this little box, and it wasn't a little box, and we exposed people, or we allowed people who shouldn't have died die.
Yeah.
And it's, it's really hard, and you have these healthcare workers who are on the front line, and they don't even have equipment, and you've got a stockpile.
Right. That's right, because
even though you have your PPE, you still have those particles in the air. Right. And so now, we didn't think of that. Well, that's because you planned it from your perspective and not from an overall perspective. And I think that's a lot of it.
Well, that's when you have to step forward and remind them the buck stops here, and since it does, I'm not letting you spend my part of it unless I know what you're doing. Patricia Nero, former chief pharmacist of San Mateo County, I can't thank you enough for sharing your story and your passion for medicine with my listeners. Thank you for joining me in conversation, and thank you for listening.